for coming once again, and Happy New Year to everyone. So this evening, we're just going to do a s- a- an update on COVID-19. We haven't done
Yes.
one for a while.
Mhm.
So there's some more developments. It's as though I was telling um, Dr. Sherry that it's like this thing won't leave us alone.
Oh, yes.
It
Like we
won't.
have to live with it.
Yes, but it won't go away. It
Mhm.
won't give us a respite, you
Yep.
know, but we have to keep pressing through, and we
Yes.
know in whom we trust and whom we believe, and we know that trouble won't last always.
Yep. Yep. Yep.
But joy comes in the morning.
Yes.
So
Yes.
we're looking forward to the joy that is to come. So everyone can see the slide because
Yes.
I don't, I'm not a Microsoft person, but this is a PowerPoint application. So I don't know if everybody can see this.
Yeah, it's
We can
clear.
Uh,
see it. It's
all
clear.
right.
It's clear.
Okay.
Mhm.
All right. So we have another variant of COVID. We've experienced the original, and then just so many variants. Just I don't know. So every time we look around, there's another variant
Different.
because this virus continues to um, shift and change. And we are susceptible to the changes that occur. And a lot of it is because we're like a reservoir for this virus, and it has the opportunity to grow and to change, and then it gets distributed, it's spread throughout all of us, and we're susceptible to it. And here we are again with another variant called the JN1
Wow.
variant. And it is now the most uh, widely circulated variant of COVID in the US and spreading around the world, of course.
Mhm.
So here we go again. Um, I don't know if anybody has been keeping up with the news,
Mhm.
but the CDC has reported between 12 and 1,500 deaths due
Mm.
to COVID in the last couple of weeks. So the death count continues to rise. Um, because there's no reporting now of cases, we don't have a handle on how many people um, have this new variant because testing is there, but there's no requirement to report anymore. So the only avenues available to find out what is going on is for the CDC to test the wastewater. Okay, so we all use the bathroom and so that gets flushed down the drain and that gets into um, the plants that are there to sanitize the water and stuff. So that's the only avenue that's available to measure the amount of COVID that's circulating because we do excrete um, the virus into our urine, etc. And that's how they can measure now just what is the prevalence of the virus and what are the variants of the virus. So the wastewater numbers have increased. So, and plus the deaths, of course, because deaths are reported. So that's the other avenue to find out how many people have succumb to the virus. And then the other methodology is how many people are hospitalized with this new variant. So those numbers have increased and have risen, and this new variant is most prevalent. So that's where we are now with COVID. So this slide, next slide, just describes what I just talked about, is how we're able to track the virus now, since there's no more reporting when people go and get tested or you do self-testing. I mean, there is an avenue available if you self-test that you can self-report in order for us to get some idea of just how many people are ill now with the virus, but it's not the most accurate. It's not like what we had before. So this is where we are. So as of January 5th, the CDC is reporting that 62% of the virus, the COVID virus that is circulating, is this new variant called the JN.1. And so that is an increase from the past 2 weeks, where it was 44%, now it's up to 62%. So they're observing this increase in travelers and wastewater, as we talked about, and other parts of the world. So let's go to the next step. So this describes what we should do. So we know, again, the best way to protect yourself or to help you not get seriously ill or to recover from illness is to get the updated vaccine. So a lot of people did not get the last vaccine because there is vaccine fatigue. You know, people are tired. They got so many shots the first time. They got 2 shots, and then, you know, it seemed like every 6 to 8 months we were getting another shot. And so this fall there was another shot, or last fall, I should say, 23, there was another booster or shot released, but a lot of people did not get it. And so that probably has contributed to this virus incubating and spreading and you know, and taking a hold in the population. So there's so much misinformation out there by so-called experts. All right. So recently, I'm sure you've also heard that, like last week, the chief medical physician in Florida actually had said, "Oh, the vaccines cause cancer." That was his statement, was that the vaccines cause cancer. Well, because the vaccines, the mRNA vaccines, this was his rationale, that the mRNA vaccines, which the Pfizer and the Moderna are, those vaccines break the DNA, okay, because these are mRNA vaccines. Well, it's very difficult for any foreign agent to get into our DNA. Our bodies are well designed so that any foreign agents like cannot get into our DNA and break our DNA chains. First of all, you need a receptor on your cells for the mRNA to attach to get into the human cell. So that's not possible because we don't have receptors on our cells to allow the mRNA vaccine to get into our cells. So, so we have to debunk that myth.
Scary.
And but that is being, propagated and heavily propagated. The other thing is that people are not taking advantage of Paxlovid, which is the medication, and the Paxlovid, when you have COVID, the Paxlovid works very well in preventing death. So they have data that shows that deaths, if someone takes the Paxlovid, that the death rate decreases if they have, COVID and then they take the Paxlovid. So that is also being, a lot of misinformation is being spread about the Paxlovid. So these are things that you have to be aware of. So always do your research. We always talk about that if something if someone is saying something to you, go and do your homework, right? Go and do your research. It's just like, Bishop Caesar always says, don't take my word for it, right? Go to the source. Go to the Bible, go to the word and read it for yourself, okay? So it's the same thing here. Is that when you hear something and you're not sure about it, go to the source, go look it up, go do research yourself, get the information yourself, and learn, on your own. And especially now because of the misinformation that's out there, the social media, the internet gurus claiming to be gurus that are out there, saying that they are experts on this, and then they begin to tell you something that is questionable, and you may have doubts about it, but you say, oh, so and so, they said this. No, go look it up for yourself. Go read about it for yourself. Go talk to, your provider for yourself and get the information and see what is. And of course, we always pray about everything before we do anything. So, that's our ultimate source of confirmation is from the Lord. That's what we do. That's how we live. So, um, do your research. So again, you have to look out for the things that we've always spoken about in the past, about wearing your mask, especially in crowded situations, washing your hands, make sure you're in a place with good ventilation, and of course, take your boosters. And if you do get COVID, test yourself quickly if you have symptoms of like an upper respiratory or just not feeling well. Know that this new variant is circulating, so go get yourself a test kit, get yourself tested. The government, I think, on that covid.gov, Sherry, I think they're still giving out test kits. 'Cause
Yes, they're still giving it
yes,
out.
yeah,
Okay, let me find the link.
I think you're allowed to get
4,
8.
8,
Cool.
okay. 8,
Yeah,
okay, that's
I
good.
think, yeah. So I
I think
think
that's a good news to spread.
right. So you can go on covid.gov, I think it,
Oh, yeah.
and order new test kits. And I think the max is 8, so that would be 2 sets. So they will mail you, the first set of 4, and then I think you can go back on and order a second set of another
Yeah,
4.
I heard that on one site.
Yeah.
Beautiful.
So it's believe it's COVID
I
document.
found it. I'm gonna put it in the
Yes,
now.
okay. So, again, protect yourself, if you have an underlying illness, um, diabetes, different weakened immune system, autoimmune illnesses, protect yourself, wear your mask, watch the conditions that you're in, and make sure you get your updated vaccine so that you can, reduce your risk. Now, the way things are spreading, I don't think anyone can ultimately avoid COVID, but you can reduce your risk in terms of getting sick
Mhm.
and, knowing that you have choices, you have options. So you have the Paxlovid and, you exercise your caution. So, the Paxlovid, just to remind everybody, it's a pill and it's taken twice a day, and it treats mild to moderate COVID. So it stops, the progression to severe COVID. So it works really well, and it decreases, um, the amount of deaths that people can experience if they're untreated. So I think that's pretty much it. Um, any questions? Anything to that everyone wants to know?
I think before we ask a question, I just wanna cause sometimes testimony is always like the best way of
Mm-hmm.
training people. I contacted COVID recently. I think I started feeling unwell on Thursday. And he was like, oh, why am I feeling like this? And it was so different because I woke up and I was feeling very cold upstairs in the room. I'm like, why is it so cold? This is a different kind of cold. Like my body was like icy cold. So I said, Then I had a blanket on, and I turned on the extra heater in the room. Still, I was feeling cold. And I asked my husband, are you not cold? He's like, I'm okay. I'm like, something is wrong here. Then I say, you know what, I'm going to I had to go and drop something up at the Rolom office. Normally on Thursday, I go to the Rolom office because I'm almost remote from my other job. So I just stay at the Rolom office. So I say, you know what, instead of going in, I'm just gonna drop off what I need to drop off, then I'll come back home. So anyway, I came back home. I said, let me test myself. Then I tested myself. Then I was positive. So I said, okay. So let the whole thing begin. Then it was mild symptoms apart from like the fever and the coldness. So I said, I'm gonna try to just treat the symptoms and see how I feel. But I will isolate myself. So I went to the guest room. So I stayed in the guest room on Thursday night, Friday. Then by Friday, like maybe Saturday morning, then I started feeling like chest tightness. By that time the fever was gone, the cough and has reduced. Then I was feeling chest tight, and I got a little scared. I was like, okay, it looked like some of the symptoms is reducing, but now I'm having severe symptoms. So I say, let me just take the Paxlovid, because I always have like a set of Paxlovid at home. Like there was a time I had COVID. I think it was a mild symptom, but I didn't take anything for it. So I'd called for the Paxlovid, so it was home. So I started taking it right away on Saturday, and then I called into the doctor to get a fresh prescription. So that helped a lot. As soon as I started to take it, of course, the chest tightness went away. But one thing that I ate most about the Paxlovid is the nausea feeling. It's so like annoying. But you have to count the benefits and the not so good part of it. So yeah, and then you take your 5 days, the 3 tablets, one in the 3 sets in the morning, 3 sets in the evening, and then for 5 days. And so this is today's the third day, so I have 2 more days to take it, and then my husband is picking up the prescription, so that God forbid somebody else has it. If we travel, we have one handy to start taking care of ourselves, because we travel a lot. That's something we had of the country. So just
Yeah.
want to say this to encourage you, all that Dr. Crony has said, on point, and
point,
you know, try as much as possible, wear your mask. If you need the testing kit, always have one handy, because you never know when you need it.
Yeah.
We have the
Yeah.
box
Yes.
that was left by the church. Before you go inside the church, there's a box by the entrance. There are test kits in there. So I'm sure I'll check to see if we still have more. So just grab, you know, a few so that when you need it. Also, you can order from the website. That's 8.
Website, yeah.
And each one has 2 in it, you know.
Yeah.
So yeah. So even though you get yes, you have it. So be mindful, you know, plan ahead. You don't want to wait until something happens, then you're trying to run to the pharmacy to get this, to get that, you know. And with the Paxlovid, you can actually just call you, at least with my clinic, you know, the number, Dr. Crony and I would check out that government number, but there was a number we used to be able to call where you can speak to a doctor,
Yeah, but no more,
doctor. But
yeah.
I tried that number on Saturday, it wasn't going through. They said they were not working, and I tried on Monday. It told me it wasn't working the way it used to work. So we have to check to see if there's a new number. But what I did was,
you can always, you can always call the city Department of Health as well, and they can direct you to where to go. There are few mobile test vans still around, and I think there's still the one by Farmers America for those in the Jamaica, Queens area. And you can always get test kits from some of the libraries, the fire department. I'm trying to think.
Library, fire department, and
Where, let me,
please.
I had a list.
Yeah, then also Walgreen is actually giving Paxlovid. I just researched that. Walgreen, you can call them, they may be able to prescribe Paxlovid for you. I don't know if it's all of the Walgreen, but you can call them over the phone. You know, the beauty of the one that the government was doing is you could call over the phone. But if you have a relationship with your doctor, and it, like what I had to do was I just called my doctor and I said, I'm not feeling well. I'm having symptoms of COVID. I tested positive. Please put in a prescription for me. And because he knows me, you know, and he trusts my judgment, and he asks a question, you know, then he just said, okay, no worry, I'll put it in. But some doctor may ask you more questions, but they should be able to do it over the phone. Because the goal is for people that are infectious, not to come into the clinic, is for them to be able to get telehealth, you know, while they are like at their home and get the medication. Some medication can even, so pharmacy will deliver it to you, but some you might just have somebody in your house to pick it up. But some have you drive through and then you pick it up.
So in the Jamaica area, you can get the test kits at the Ozone Park Library, at the Rosedale Library, Roy Wilkins Recreational Center, you can get it at. And there was a site in Far Rockaway, which I'm not remembering now, but those are
maybe the Tin Library.
I'm sorry?
Maybe the Tin Library right on Beach 20th.
Let me I'm trying to look it up quickly.
I think they put that library on the 20th or 9th.
But you can get it, you know, you can get it at the fire department also. So there's a number of locations where you can get test kits. You know, but you can go to COVID .gov and get they'll send it through the mail.
Yes.
And they send 4. There are 2 test kits, but each test kit has 2 tests in them. So there are 4. And then I think you can get another set. I think the total that you can get is 8.
Yeah. So once you click on that link I put in the chat, you will see another link. You see like a tab in that link when you go on that says order your free test kit. It's very fast and simple. You order it and they send it to you.
But you also, just should get the vaccinations if you can, the updated one. And the pharmacies can give you the vaccine. You just need to ask at your pharmacy if they will, give you the booster or the shot. Because I know several pharmacies do, and you can even get it at Costco. Because someone told me the other day they got it at Costco. So there's, multiple locations that you can get your updated booster as well.
Yeah, so that's all we have for you. We just want to encourage you to be safe, wear your mask, as
Yes.
much as
Yeah.
possible. Because Sunday was actually telling me that at the hospital, 1 out of every 3 person that comes in sick to be evaluated, they either have COVID, RSV, or the flu. Is like the respiratory infection
True.
is on the rampant. So
Yeah.
you're not just protecting yourself from COVID, you're also protecting yourself from all those other viruses that are equally nuisance and annoying to contact. So just want to be careful with that. So thank you so much, Dr. Cornell, for sharing the
Okay.
update with us.
Any other
you.
questions,
I'm gonna stop
anybody?
recording now because I want.
Dr. Cooney,
Yes.
and hi, this is Michelle.
Yes.
When I was working even though I had the vaccine, when I was working before I retired, I ended up with COVID. I find that it just had a symptom for one day. But afterwards, I found out my back, my back where the lungs are located,
Mhm.
it was like I was boxing with someone. So what relieved me was that I didn't sleep on my back. And I tried to do the arm exercise, lift my arms up and do the side to side movement, and it kind of helped me. So I was just wanted to know what have they said something about in regards to you have other taking the medication, the Paxlovid, eating right, sleeping, drinking a lot of fluids. What about the kind of movement that someone can do to help, because it does affect your back a lot? That's
Well,
what I
you can always
our
do,
exercise.
like, go to get a nice steamy shower. You can, they have these massagers that you can buy with heat in them. And so you can try that, just do a lot of stretching. I found when taking the vaccines, it's best to like move, do some movement, so that your arm is not sore and, your body doesn't like tighten up and stuff like that. But certainly you can, do those things, take a nice hot shower, let the water run on your back, and and just, or if you have a jacuzzi tub or something like that, you can get in there in the whirlpool, get a massage, just use your muscles, just keep the blood flow going.
Okay.
Yeah.
Because it really wants you to stay in bed and
Yeah,
and hold the
yeah,
pillow, that you just want to just go straight to bed and
yeah, but you
drop
should,
yourself there.
but you should do the opposite, you should keep yourself moving, keep the blood circulating, keep the blood flowing, and that will definitely help, with any muscle soreness or any discomfort that you may have. Yeah,
Thank you.
but it's best to take those shots, and because when you look at the data, just the pure data in terms of the hospitalizations and the decreased mortality is you know, you can't argue with that. So I would take a little muscle soreness and achy pain or whatever over
Oh, absolutely. Yeah.
True.
ending
Oh,
up
yes.
in the hospital,
Hospital.
you know, and suffering through the afflictions of the hospital, as most of us here who have worked in a hospital knows. We know the inside track, the poking you at 2 a.m. in the morning
Mm.
to get your blood, or because your IV line stopped working. So yeah,
Yep, we don't want that. So you just better,
yeah,
you know,
yeah,
protecting yourself so that even if you have it, it's not that severe. So you want to protect yourself.
exactly,
You want to
exactly.
protect yourself.
Because you can do those things, you know, you can use a heating pad, you can use the massager, you know, you can use all those things. Um, and those, that soreness and muscle aches and pains, those will resolve, you know, but with COVID, you don't want the risk of long COVID, you know, where people have the blood clots and the you know, the neurological deficits and all of the respiratory deficits that go along with having long COVID. You don't, you know, you want to avoid that. So the best way to avoid that is the prevention, which is to take the shot. And if you do get COVID, the symptoms will be mild, and, you know, take the Paxlovid to ameliorate the symptoms and reduce your risk of hospitalization and, you know, other sequelae. So I'd rather do that. I'd rather put up the muscle soreness. Believe me, the first time I took the COVID shot, the very original one, I couldn't move my arm for a week. My arm was so sore, and it had swollen, and it was just, it was painful. And I had that for about a week, you know, but I had to move my arm. I had to exercise my arm to get that swelling down and to get that pain to resolve. So by the time I took that second shot, I knew what to do. So I didn't have as much suffering as I did the first time. And then the subsequent shots that I took, you know, I knew what to do. So I knew that they might make me feel a little out of it for a day or so, but I never got that arm swelling that I did as I did the first time, because I knew after that first time, do not sit down, don't keep moving, move your arms, exercise, just stretch, do whatever, right? I knew that. So I never had that swelling and that pain in my arm again. I might have felt a little fatigue, but I also knew, get up and don't let this get you, right? Because this past fall, I took both the COVID and the flu shot in the same arm, same day. But I knew I had to work it out, right? Get on that treadmill, go outside, walk, move, do everything so that I would not succumb or feel like I want to crawl under the covers and just, you know, go to sleep. No, I fought it. I fought it.
Amen. Okay, thank you so much, everyone. I want to invite you, ladies.
Thank you,
ladies
Nancy.
here. I want to invite you guys to our exercise group. So if you're
on
interested,
Saturday.
yeah, it's on Saturday at 7:30. I know some people don't want to wake up that early. But you wanna do it and get it out of the way, you know, and your body would thank you for it. I think that's so good. You can testify.
Yes, I
So-
can.
I've
It's
seen-
been
I've-
good.
I've
It's-
seen the weight loss on TV for the month. I've been watching you guys
You've been
And
watching us.
Dr.
You see
Kun,
the
I've
difference
been
in our
I've
body.
seen the difference. I've
Uh-huh.
seen, and
I-
I'm the one gaining the weight because I couldn't work out. So, but I know how to lose it. But the exercise will definitely help. So I'll
Yeah.
see if I can make it on
I
Saturdays.
will
I'm not quite.
I'll put the meeting ID in the chat.
Yeah, and it's
Thank
really
you.
not about losing
Thank you.
weight
Yeah, that's
so
what I was
much
about to say. Go ahead.
as it is about gaining muscle mass and muscle strength, because
Okay.
really, if you don't use it, you lose it.
Yes.
And you want to have your muscles to maintain their strength and their flexibility for your joints, you know, and to have to maintain your balance,
Yeah.
because these are things that can erode as you get older. You know, you can lose your muscle mass, and then when you go to pick up that 5-pound bag of sugar
And you heard
that you picked up with ease, or that flour, then you're like, oh, why is this so heavy? It's not heavier. It's just because, you know, your muscle mass has declined. So it's about maintaining that muscle mass, gaining that muscle mass, and maintaining your flexibility and balance. So, you know, we're not bodybuilders. We're not there to, you know, compete in the next Ironman competition.
Iron
So,
Woman.
Iron Woman competition. But we're just there to make sure that we keep our muscles toned, and we keep ourselves in somewhat fit, good shape. And we have
Absolutely.
a wonderful trainer, a wonderful, wonderful trainer. Some of you know her, Sister Alvita Carter. And I don't know who remembers her.
I remember her.
Yeah, okay, wonderful. So she's, you know, wonderful. And we have an inspirational group of women, and we're there for purpose, and we just get to it.
Yeah, yeah, yeah. Yeah, and also, you know, to add to what Dr. Corney said, it's not about the weight loss. Also, you know, sometimes you get older, if you fall,
It's a tone.
you fall, you know, but because you have been building your bone and all the exercise, your muscle, it's easier for you to not be as injured as you will have been if you were not exercising, you know. So you have that flexibility, that strength, you know. So I think, you know, and it's not doesn't have to be excessive, because there's always like different adaptation. If you can do like the heavy one, she'll be like, okay, if you can't do this jumping jack, this is the adaptation, this is the one you do. The most important thing, you're moving, you know, even if you're not moving as maybe Dr. Coney is moving or Natasha is moving, you're moving, you're doing something. Because like I always say in church, we're not made to be couch potatoes. That's why we have joints. They're made to move. And so when we keep them from moving, of course, it's going to degenerate, you know. So the whole idea is to increase muscle tone and all the beautiful things that Dr. Fernie said. So if you're interested, you know, you can join. The link, the thing is there. The number is there. If you want the link, just shoot me a text. I don't want to be hounding people, but I want to support you to do better. But I don't want to be like, oh, here comes Sister Sherry again. So
And just go at your own pace. You know, go at your own pace.
Yeah.
Because I know before the shutdown, before the COVID shutdown,